If you asked someone why they became a doctor, they might say they had life-changing care or were inspired by a family member. But sometimes the mystery of medicine is enough.
We didn't have doctors around, and I didn't really know any doctors. I had an uncle that was a veterinarian, and the only reason I was interested in medicine is I like science, but I also like helping people.
When college came around, long before Joe Mathey had doctor at the beginning of his name, he recalls orientation and the startling words imparted by the dean.
I said, half of what we're going to teach you in the next 4 years will be obsolete by the time you leave these walls. So if any of you are not perennial students and want to keep on learning, then do yourself a lot of good, save a lot of money, save a lot of sleep, and a lot of hard work, and get up and walk out now. We were stunned.
Not having a clear sense of where his academic journey would take him,
I was one of these strange guys that went to a liberal arts college where I'd rush over from an intermediate level physics class to Shakespeare, or organic or biochemistry over to an English lit class.
Eventually, the time came to declare a specialty, and he was drawn to the variety family medicine offered.
Most of my life I practiced when they didn't have CAT scans, MRIs, diagnostic ultrasound, a lot of the lab tests that we have now. So we had to practice by deductive reasoning, asking a lot of questions.
Years later, with ever-growing knowledge and experience, Dr. Mathey says he couldn't keep everything he'd learned to himself.
Knowledge gained, if you don't use it, is kind of knowledge lost.
And he continues to put his knowledge to practice by helping further the education of new and aspiring physicians.
He is confident in certain parts of physical examination, such as the abdominal exam, which is probably the hardest thing to do for most doctors, and because there's so many different things that could be going on in somebody's main part of their body.
In an ironic twist, the students find themselves turning to an old dog to learn new tricks.
In working with our residents and students here, I really like to emphasize, how to examine hearts, how to examine lungs, how to feel a thyroid and find a nodule. And I show them different ways to do that.
Senior residents, like Isaac Wilbur, hone in on foundational skills alongside someone with half a century's worth of knowledge.
He would be the grandfather figure of the program.
And just like a curious grandchild, the residents turn to him for answers.
A lot of them come to me for, they want to learn more about physical diagnosis, bedside diagnosis, the hands-on medicine. And I like that part of medicine the most.
A like that can only be described as a passion.
But I'd probably do it even if they didn't pay me. I like it. It's fun. I absolutely thrive on it.
50 years is a milestone, not an end for Dr. Joe Mathey. He plans to continue teaching at Arnot as long as his mind allows. For Arnot Health, I'm Lexi Cutmore.